Thank you for visiting Plan Your Recovery's website. I hope you find the information you need here to get started on the road to recovery or for finding the right treatment for you or a loved one. Plan Your Recovery has three types of programs, one for teenagers, one for young adults and college students, and one for adults. You can learn more about those programs on the specific pages dedicated to them. Plan Your Recovery takes a non-judgmental, supportive, patient-centered approach to addiction. We try to use all the best evidence-based practices to help people get well. In the earlier years, in the teen and young adult years, that means a lot of contingency management and family involvement. In the later years, it can mean a lot of pharmacotherapy to reduce cravings. There are FDA-approved medications for both opioid use disorder and alcohol use disorder. All along the spectrum of treating addiction, we collaborate very closely with child and adolescent psychiatrists and adult psychiatrists and physicians to try to use pharmacotherapy when it's indicated for the patient. We take a team approach. Oftentimes, one of our therapists will be working with the individual, the other will be working with the family. And I take a lot of pride in the team that we've put together. Matt Silva and I go way back. We've been working together really since the beginning of my career in addiction treatment. Matt is perhaps the best all-around counselor for addiction that I know of. He can work with teens and older adults and everything in between. He's a lifelong learner. After getting his degree in professional counseling, he went on to get an MBA. He's held administrative roles in large treatment programs, and yet he comes back to his desire to help people as a counselor. Right now, he's actually finishing a dissertation on the practice of substance use disorder counseling to get his doctorate. Michelle Charbonnier is also the Deputy Director of Missouri Network for Opiate Reform and Recovery, where I serve on the board. Mo Network is oriented towards helping people, even when they're not quite ready to stop addiction, try to decrease the harm that they're experiencing in their lives through disease transmission and other social determinants of poor health. And so, they run a syringe exchange program. Michelle has been integral to that organization, trying to help people getting people help wherever they are in their addiction. She runs groups for family members all over the city, trying to support family members who are supporting their loved ones who are suffering from addiction. She runs a group like that at Plan Your Recovery as well. Every Monday night, we welcome anybody from the community who has a loved one suffering from addiction to join a group with Michelle. Michelle is also a trained yoga instructor, and so she brings a special focus to her work with patients. A lot of times, patients who are recovering from addiction just don't feel comfortable in their own skin now that they've been separated from something that they use to feel well. Well, the wellness arts like yoga and mindfulness can be really helpful to someone who is trying to find a way to feel well in recovery. And Michelle brings that special skill set to her work. Our newest member of our team is Julia Katzman. Julia I've been working with since she was in her master's degree, and now she's graduated as an independent professional and works with us at Plan Your Recovery. Really, it's been Julia's energy and enthusiasm for our contingency management program for teens and for young adults that has helped us to grow the program and really focus some of our energies there. Julia will often work with the individual teen and young adult while I work with the families and really provide effective all-around approach to helping eliminate substance use or substance problems at that sensitive developmental period. She also is trained in cognitive behavioral therapy and can work with the whole spectrum of teens, young adults, and older adults on co-occurring issues like anxiety and depression. She is an avid and eager learner, a good thinker, and we're just so happy to have her on our team. I almost always have a practicum student who's also learning in the program. We're not only trying to treat addiction in the patients that we serve, but also to train the next generation of practitioner. We love addiction treatment. We're always learning ourselves and trying to make our program better and better. At Plan Your Recovery, treatment starts with a conversation. It starts wherever you are as an individual or with your family. And we pride ourselves in having the knowledge to help you consider all your options for taking those first steps in recovery or those second, third, and fourth steps in recovery if you've tried things that have not worked in the past. Recovery is not always linear. Sometimes people have periods of really great health where their addiction is in remission, and then it flares up just like any other chronic condition. Our job is not to try to achieve perfection in all cases, but to meet you where you're at and help you to reach your own goals. Addiction shouldn't be seen as different from any other chronic condition where a person may need special kinds of help and assistance all along the way. We do our best to provide the highest quality care to you and to your loved ones who are suffering from addiction and trying to make significant changes in your lives. Treating addiction is a wonderful field to be in because people really do get well. At its worst, addiction can be devastating. It changes the whole personality of the person suffering from it. Even in teens, we see these radical loss of self that can be accompanied by the use of substances that become out of control. And yet when they come in control, when a person starts to achieve freedom from that addiction, that personality comes back. And so it's an extremely gratifying field to work in, as challenging as it is. And if this is the right place for you, we look forward to starting that conversation with you and continuing it as you address the challenges in your life or the challenges in your family. Please take a look at all the different pages on the site. If you're looking to start treatment, you can start with any member of the team. All of our contact information is on the staff page. Any one of us can get you started and have that first conversation in which you consider the different options to you for getting well or for addressing a concern in one of your loved ones. Thanks again for visiting us. We hope to talk with you more soon.